Fear and anxiety about COVID-19 and what could happen can be very, very, very overwhelming. Social distancing guidelines are making people feel isolated and lonely, which increases people's stress and anxiety. In addition, COVID-19 has also brought to surface many racial inequities in the United States. Black people are dying at a disproportionate rate due to the virus and also recent extreme police brutality and violence. It layers on top of the intergenerational trauma of racism rooted in slavery, mass incarceration, police brutality, and then also Black oppression. Joining us to provide a point of view on this matter, I'm joined by psychotherapist and founder of the Association for Trauma Outreach and Prevention, Meaningful World, ATOP of Meaningful World, Dr. Ani Kalayjian, and we thank you so much, Dr. Ani, for being with us.
Thank you so much. Good morning, Pastor Jaime. This is again, yet again, I may sound like a broken record. I felt the shock and disbelief, and I said, this must be old news, and I just tried to pass over it and click over it, and no avail. It just really broke my heart so much, and then the after effect afterwards, when I read more about the Wisconsin shooting, and we talked about this, less than a month or so ago, Daren, and it's still for me a very, very painful, very tragic moment that we have to repeat this story instead of moving on, building on sound infrastructure that's based on respect and pulling one another up and acknowledging the past trauma of slavery and expressing remorse and asking for, begging for forgiveness. Now we found ourselves with this shocking news in the broad daylight and repeatedly shooting. I was like, stop, stop, stop. The man is not doing anything, going to his own car. What's wrong with you? What is the psychology and psyche of the police? And we talked about this in terms of training and helping the police to be mindful sometimes, because Pastor Jaime, if you are traumatized yourself, sometimes you don't know what you're doing. So I'm wondering, are they traumatized? Are they seeing a lot of traumatic situations that are getting numb to it? We have, remember the program we had, a panel with the person who was training the police from John Jay College, Dr. Maki. And she was like also hopeless about the training that we were talking about.
Well, let me jump in here and talk about this for a second, Dr. Kalayjian, because for those of us who are just joining and talking, we're talking about the shooting of Jacob Blake in Wisconsin. He was shot on his way to a car after an altercation, somewhat of an altercation that we understand with police officers, shot in front of his children, shot in the back, currently paralyzed from the waist down, and yet another trauma that America has been forced to deal with in broad daylight. Dr. Ani talked about broad daylight. What exactly does that look like? Well, when you look at Ahmaud Arbery, that took place in broad daylight. When you look at George Floyd, that took place in broad daylight for 8 minutes and 46 seconds. And now to look at Jacob Blake being shot to 7 times in the back by police officers, again, in broad daylight. There's something to be said, Dr. Ani, about the trauma. There's something to be said for a mindset of people, because we're highly traumatized. We're watching this on video, first of all. And second of all, as you said, this is a video that's being done in broad daylight. And when you watch something in broad daylight, there are some subliminal messages that one takes and feels traumatized about.
Most definitely, it traumatized me, and I know a lot of my friends kept on calling me, did you see this, did you see this? And my body was having like a earthquake reaction, hypervigilant and re-traumatization, because I come also from trauma of my father from Ottoman Turkish genocide. So that doesn't really go away. Of course, I manage it, I work on it, and I've teaching about it, and we have free support groups every Thursday trying to help people lift one another up. And we have done so much positive work. People were feeling empowered. People were feeling we can do this. And Black Lives Matter, of course, all lives matter. But at this point, this people of color have been experiencing extreme levels of trauma, both personally as well as collectively, as well as repeatedly when we view it. There is no way but one would not feel vicariously traumatized. And it's really challenging at times where we are also dealing with COVID-19, the economic hardship, the emotional outcome of COVID-19 that's isolating, depressing, and debilitating people. Suicide rates are high, much higher, 30 to 50%. Depression and anxiety are as high as 50 to 60%, depending in communities. Of course, communities of color have also more of these traumas because of the two pandemics merging and creating this explosion, tsunami of after effects that traumatizes us even more.
When we talk about the trauma, not just the trauma associated with shootings, but also we know about COVID-19. We're not out of this yet. We're still dealing with it. We're dealing with soft reopenings. We're dealing with places across the country that are actually closing up doors now, realizing that the COVID-19 pandemic is really affecting their community. Talk to us about this, because for us, we talked since March in New York when our doors started to shut down, but here we are, and we're talking about September, and we're still seeing things, and no real easy end in sight. The psychological trauma and the effect of dealing with COVID-19. Give us a little bit about ways that people can kind of like cope and handle during this time.
Yes, that's a very good question because we have very step-by-step helpful hints, helpful strategies to transform this mega isolation. Um, and I would like everyone to stop calling it social distancing. We cannot, we're a social being. We cannot distance ourselves socially. We're physically distancing temporarily to protect one another. That's a huge difference. We need each other socially to connect and to appreciate and to love and to, in many other ways, show our solidarity with one another. So we first must keep our routine. I don't want to hear this day pajama and night pajama. I want everybody to have the same work schedule, wake up as you did before COVID and get dressed, put your makeup, shave, do everything that you were doing before. Don't get into the rut of moving from the bedroom to the other room with your pajamas and not paying attention to self-care. Self-care is very, very essential at this time. So keep your schedule strictly, abide by it very strictly. And then during your breaks, come outside and walk in the park, in your garden, in your streets, and enjoy fresh air, because going from one room to another, staying indoors all day is not good for COVID, because we need the vitamin D. We need the vitamin D not only from the sun, but we need the supplements. Please take them as much as you can. And I want you also to take something else that also protects your immune system. It's called L-lysine. It's a natural amino acid. And I take it, and it doesn't, when you take it, you don't even get colds. It really strengthens your immune system. Try to include in your juicing ginger and cardamom and turmeric and a lot of berries so that you can drink that. That would help support you. And sleep in regular times, whatever time you were sleeping before, because when you're not sleeping between 12 and 5 is the most important hours of sleep, quality REM sleep. So don't tell me you're staying up until 4 and then you sleep until noon. You're going to be groggy and you're going to feel more anxious and depressed. It does not work with us. You need that quality sleep. And try new things. Some people are reporting cooking with their kids, engaging their kids, because children also are bored out of their minds without their friends. You know, this is a very, nobody's talking about this, but this is very challenging for children because children are moving through developmental stages, and every month and every year is very crucial for them. They have to go through certain steps. They have to establish friendship. So if they're not seeing one another, they're missing out on that. So you need to creatively engage with Zoom parties and FaceTime talks with their friends to help them bond and create that friendship that is very important for our development. And organize your closets, your house, your drawers, organize and clean your environment, declutter. That environment is very important because we shape the environment, but then the environment shapes us and gives us the emotional feelings. If it's cluttered, we feel anxious and angry and fidgety, but if it's really nice and organized, we feel relaxation and contentment and happiness. And try to also do things that you wanted to do all the time. You didn't have the time for, specialties, reading, non-professional, like fiction or whatever your desires are. Creating YouTube films, we all need to learn. So if you found something interesting, creative, share it with us. So all this creativity and engagement and a schedule keeps us focused, healthy, and anxiety free.
We talk about loneliness though, because you're giving us some help here, but loneliness is very real during this time. And you talked about the kids and what they have to go through. The kids feel a sense of isolation. Adults feel a sense of isolation. And I've talked to some very, high profile professional people, and they're feeling, the sense of cabin fever and loneliness. And so overcoming that and dealing with that, that's a big challenge that we all have to face. What do you say? I mean, you gave us some things right there, but what do you say to that whole issue of loneliness?
Yes, that is huge. And that's why I mentioned about keeping strict schedule, because this isolation, physical isolation, is causing social isolation. That's why I said words are very powerful. Be mindful, don't call it social isolation and promote another problem. Just call it what it is, which is physical isolation. Yes, we can't have big parties of 50 people or over 50 people, but you can have a small gatherings in a park. You can ask your friends to meet in this park. They come with their mask and with the physical distancing, and everybody brings something to eat, and you share this time together in a safe place in a park. So try not to be very paranoid and strict about your isolation, because you do need to expose yourself and be around other bacteria, or else your immune system is not working well. The immune system needs uh, exercise and experience. So you cannot keep yourself in a room that's not healthy for you. So think about ways you can engage in a park, walking, hiking. When I go hiking, I call friends and say, I'm going walking in this park. And some people who can or are not afraid are coming out and joining in walking. So we're doing something we love. We're embracing nature and connecting with Mother Earth. And then we're seeing our loved ones that we haven't seen for 6 months. So you have to start doing that. We cannot continue being isolated in our own homes like prisoners.
What are you hearing with yourself? I've asked, all the guests, what are they hearing in a time like this with people who have boots on the ground in the psychological field? What are we hearing from people that maybe us in media and us as a community are not really paying attention to?
what is the media not paying attention to? Yes,
Hmm.
the media can use more programs like yours, Perspectives, Pastor
I'll take
Hyman,
that.
where you're giving tools to people, how to. We love to have lists, right? Do this, do that, do that, do that. And that gives us order. Order gives us comfort and releases the anxiety and brings us together. Oh, this is what Dr. Ani said. Oh, okay, I'm going to try that. And we have weekly support group. People can come and join. And ways we're trying to find ways, and media can do a lot more by giving the recommendations, sending list of things. This is how you can feel connected. This is how you can feel that you're not isolated. We are here with you. And these are like, we have Zoom yoga classes, for example. Now I started doing yoga classes. I teach yoga. I'm doing it in my garden where people can be 6 feet apart, and they still uh, exercise, get the fresh air, and feel like they are part of community. The same thing with the senior centers. They are too doing activities outdoors. So media can step up and share these good stories where people are, in spite of physical isolation, they are doing things to connect us socially.
Yeah, we
Excuse me, because social distancing is deadly. It will really wipe out the human race.
you talk about social distancing, very, very, very important. But unfortunately, a lot of people don't engage in social distancing because they feel as though it's not important. It's not important to wear a mask. It's not important to socially distance, or even worse, the virus isn't that serious because not that many people have died. I mean, these are things that people are actually saying. But when we talk about being in New York and seeing the amount of deaths and seeing the trauma and still seeing the lasting effects post COVID, and we're not even in post COVID, but to say post COVID, the worst part of hitting the top, it's still a lot to contend with. People are not really taking this too serious.
Yes, there is the other side where one, you know, Pastor Jaime, this COVID thing and the safety and security issue is like a spectrum. On one extreme, you have people who are extremely fearful, paranoid, they're not coming out of their houses, believe me. The other extreme is they're not wearing masks and they're not abiding by distancing and they're not caring about it. I was going through Harlem, for example, and to see a friend, and I was shocked that people are gathered in huge numbers in corners. And I'm like, what happened here? Nobody's wearing masks, I said to my friend. And this is the community that is affected the most, and large number of people are dying within the color and African American communities. So there is the happy medium, which is the middle, not one extreme where you're totally paranoid and you're isolating yourself and you haven't seen the sun or had fresh air. The other extreme who think everything is above them. They're not going to get COVID, and this is not a serious disease, and they don't care about it. They're rebelling, really. But anyway, with every issue, we have extremes, but we always invite people to come to the center and to exercise their human rights, to measure their safety measurement would be different for each person. For example, if you had cancer treatment, then you would be a little bit more to the left of the spectrum or to the right, to the extreme of the spectrum. If you are older and you have other health conditions, then you may be a little more careful. But if you are a young person and you're able to cope and you don't have any history of illnesses, you're protecting yourself with vitamin D3, vitamin C, zinc, and L-lysine and other ginger and other things that I mentioned, and you're strong, then follow the rules, mask, not just for you, but also protecting others, and distancing physically, but still engaging with one another. For example, we had the Zoom lecture. 5 people decided to come in where we had a big space. They could be 6 feet apart. And the rest of the people who did not want to come, had physical or other health conditions, joined us through Zoom. So we need to be flexible, and we don't need to have one strict rule where terrifying everyone that everyone has to stay home. It's no longer as strict as that. We no longer need to isolate ourselves. We can put our mask and move on and do as much as we can within the limits of physical distancing.
Dr. Ani Kalayjian, we're going to have to leave it there. Thank you so much for sharing with us. We're going to do our best to stay healthy and to stay safe. Thank you for your contribution.
Yes. Yeah. Remember, when one helps another, both become stronger.
That's
Let's
right.
help one another.
Dr. Ani Kalayjian, thank you so much for being with us here on the Social Justice Forums. Yes, we will give you that information. Stay connected to us, that you can be connected to Dr. Ani and all the great work that she is doing. We'll be back. We got more on the Social Justice Forums coming up after